Hi, how are you? I'm really sorry that I haven't made a video in a while. I just came back from my very first physical therapy session. And it was painful, and it was necessary, and it made me very aware of the compensation that I've been doing, not just since my surgery, but for the 3 years that I've been having pain since before my surgery. I have a lot of muscle imbalance, a lot. I mean, I knew that I did, and nothing is really a surprise. It's just that now I have a physical perception of it. It's not just that I have medical knowledge and I know that my gait is off and all that kind of stuff. It's like now I see it, you know, it's... My physical therapist was very cool. Her name is Christine, I think. Hold on, I've got her card here. I have not okayed it with her for me to give out her name or anything like that. But her name was Christine, and she's a physical therapist, certified strength and conditioning specialist, certified tennis performance specialist. I don't know if that's what the initials after her name are for. I doubt it. But anyway, she was very nice. She was very knowledgeable. I told her right from the beginning, I said, listen, I need to just come here and be the patient. I will be proactive and I will do what you tell me to do, but I need to sort of take my education and throw it in the garbage because I have tried to self-diagnose and self-treat for too long and it's not working. Obviously, it's not working. Most of you know that last week, it was actually a week ago today, it was my 2-week anniversary from my surgery. And I was sitting on the couch very, very wrong. And I was trying to do the physical therapy exercises very, very incorrectly. And I popped my hip out anteriorly to the front. It was very fast. It was only for about 2.5 seconds. But it did spark an amazing anxiety attack. I posted about it on Facebook. I know I shouldn't have. I'm sorry. It's stupid for me to take it down now. Like 75,000 people responded and they were just like, oh my God, are you so sorry? Do you want me to come over? You know, that kind of thing. My parents came over right away because I called them. Yeah, I'm still a little mama's girl. I still have to call her every time something goes wrong. But anyway, I lived through that. It happened. Whatever. I won't be sitting on my couch in that position trying to do physical therapy ever again. Even after my hip is 100% healed, I'll probably be afraid to do that, that specific movement. I'm not going to get into what I did. But I talked to the physical therapist about it. She was like, wow, that must have really scared the crap out of you. I'm like, yeah, it really did. So there were a few things that she was having me do and that she was taking me through different ranges of motion, I should say, that were very scary to me. I did a lot of these, that kind of thing. And she said that, it's completely understandable. The fact that I'm so young and that I had to go through this, traumatic surgery, she said I have every right to be afraid of ruining it. But the fact is that I have to really take a very active approach. When I'm not at the doctor's office and I'm not at the physical therapist's office, I have to be very, very aware of everything that I'm doing. And it sucks because I have a lot of other responsibility. I have 2 small children, 8 and 9 years old, that are all-encompassing. Just sitting in the same room with them is exhausting. Nothing against them. They're typical 8 and 9-year-old boys, but they take up a lot of my energy. And I also work full-time. I work from home. At least I'm not commuting and not, stressing myself out physically. But I do kind of work a lot of hours in the day. A lot of the people who watch my videos are not necessarily hip replacement friends. They are also on a health journey and they're losing weight, and that's what I do for a living. So I help them on the internet via YouTube and Facebook and Instagram and email and telephone calls and that kind of thing. So if any of you who are seeing this video, you wanted to reach out to me because you might maybe want to lose weight, you can. I'm not even going to get into it in the video, but just one of the reasons why I got into the weight loss business is because I wanted to lose weight to try to help my hip. So if you have hip pain and if you are either contemplating the surgery or you have your surgery scheduled or you've already had the surgery and because of comfort eating, because of lack of movement, because of pain, you have gained weight, you can give me a call, you can contact me and we can talk about maybe how I can help you. Anyway, self-commercial is over. I am going to be doing physical therapy twice a week for 6 weeks. The bummer about it, and it works into my schedule. I'm going to have to, I'm going to have to shift a couple of my weekly phone calls around. But the bummer is that it's $50 copay, $50 a pop. So we're talking about $600 in physical therapy alone. So that's even more than my copay for the hospital for the surgery itself, which is, so I'm going to take it very seriously. I'm not going to have it be a waste of money. $600 is a lot of money. I just bought a computer for like half of that. So I'm going to try to get as much as I can out of it. I'm going to try not to waste that money or that time, because I'm also commuting or driving to a place that's kind of far away. I wanted the physical therapist that works in my orthopedist's office, or not technically in his office. They call it a quadrangle. It's like a couple of acres of doctor's offices. I'm sure every town has that, right? I wanted to be in the same network. I wanted to be on the same property as my orthopedist. So I am kind of traveling a little further than I need to, because I wanted to make sure that it was the right place, the right thing. And the person that I'm working with, Christine, she has worked directly with Dr. Alexiadis's patients before, and that's exactly what I wanted. So, if you wanted to know if you are on Long Island or in New York, the tri-state area, and you wanted the name and the contact information of the physical therapist that I'm going to, go ahead and contact me. I'm sure she won't mind if I give people the name and phone number privately, but I don't feel comfortable putting it out on YouTube. The surgeon that I saw is, I'm going to say it again, is Dr. Michael Alexiadis. He is one of the top anterior approach hip replacement surgeons in New York. He works specifically out of the Hospital for Special Surgery in Manhattan. He also has a great neck office. Unfortunately, I still have the pain that I had before my surgery. I didn't at first, because I think I just couldn't handle that much input in my brain. I really didn't feel it at first, and I felt like I had I'm not saying that I haven't made the right decision, but I was convinced that having the surgery was the right thing that helped my original pain that I've been having for 3 years. Unfortunately, that pain is creeping back. And I spoke to the physical therapist about it, and she said, well then, obviously, we're going to just move forward from here, and we're going to try to get rid of that pain. So whatever. The MRI showed that the hip was trashed. So getting a new hip is not like I did the wrong thing. I did the right thing. But maybe I didn't address the original problem. It's okay. It's okay. You know me. I'm an optimist. I'm an optimist. All right. So if you have any questions for me, just message me. All of my information is below. I have a webpage, I have a blog, I have a vlog, all that kind of good stuff. I'm not going to be posting this on my weight loss boards and groups and stuff like that. I'm just going to put it in the hip replacement groups that I'm now a member of. Okay, my name is Andrea, and I will talk to you guys later. Bye.